Welcome to the Hennepin-University Partnership Winter Webinar Series. My name is Sarah Sandgren, and I'm a graduate assistant with the Hennepin-University Partnership, here with HUP Director Scott Vargo as well. We are happy to welcome so many of you who have been attending our virtual events and also to introduce HUP to some new friends. And not faces, but names. The Hennepin-University Partnership is a strategic partnership between the University of Minnesota and Hennepin County that aims to connect these organizations at points of mutual benefit. We have goals to catalyze research partnerships, engage students by providing work experiences that enrich their learning and build the future workforce, and to share expertise, best practices, and knowledge, academic, operational, and beyond, something we hope that we will do for you today. I'm very excited to introduce our presenters in just a minute, but a few virtual Zoom reminders and instructions for our audience. Your video and chat are not enabled, but please use the chat function if you need any support from the HUP team. And if you'd like to ask a question, you can submit that through the Q&A or the chat. You'll find buttons for those along the bottom of your Zoom window. We'll monitor questions throughout the presentation, and then we will address those at the end. We'll have some time for questions with our speakers. This webinar will also be recorded, and look for an email from hup@umn.edu with a brief survey, link to the recorded webinar, and some other links related to the presentation later today. Finally, I am so glad to welcome our presenters. Dr. Erika Lee is Professor of History and Asian American Studies, Distinguished McKnight University Professor, Chair in Immigration History, and Director of the Immigration History Research Center at the University of Minnesota. Professor Lee is elected to the American Academy of Arts and Sciences, is Vice President of the Organization of American Historians, and the author of many award-winning books. Dr. Madalena Marinari is Associate Professor of History, Peace Studies, and Gender, Women, and Sexuality Studies at Gustavus Adolphus College. She teaches a broad range of courses on 20th century US history, immigration history, American identity, the US in the world, and world history, and has published extensively on immigration restriction and immigrant mobilization. With that, I will turn it over to them. Thank you so much to both of you for being with us today.
Thank you. Thank you, Sarah, for that, that gracious invitation, and also for inviting us here to join you today. I thought I would start by sharing the project that Madalena and I conceived of late last spring. Immigrants in COVID America. You can see the URL, hopefully, on your screen, which shows the homepage of our website. And I think that, like most of us, Madalena and I were trying to balance so many things as we were all adapting to the pandemic and trying to figure out what exactly was going on, what it all meant, and specifically as scholars of immigration, and in particular immigration historians, how might we document this moment in time and also help to push emerging research and advocacy forward. And so we thought that one of the ways we might do this is to collaborate on documenting the impact of COVID-19 on immigrants and refugees in the United States. We have a lot of experience working together and collaborating. We know the power of digital humanities. We recently had collaborated on the Immigration Syllabus Project. This was conceived in another moment of great transformation and change just after the 2016 presidential elections, when we realized that immigration policy was probably, and we were proved right, going to be undergoing a huge amount of change under President Trump. And so we worked together with our colleagues with the Immigration and Ethnic History Society across the country to provide historical insights, essential readings, and topics related to the long history of immigration to the United States. And so we thought that during COVID, we might duplicate and build on some of the things that we had learned with this digital project. We knew that there was still so much developing in the late spring in relationship to the pandemic, but it was becoming crystal clear that despite all that we did not know about COVID, we did know that the disease was disproportionately affecting immigrant, Black, Indigenous, and other communities of color. So we wanted to figure out how to make sense of this and to create a historical record of the crisis. We were inspired by many digital projects, many scholar activist projects that were being developed in the late spring. Some included the Yellow Peril teach-in resources. This was a crowdsourced project organized by one of our colleagues, Professor Jason Chang at the University of Connecticut, to track some of the very disturbing anti-Asian rhetoric and hate incidents that were occurring around the world even before the pandemic really took off in the United States. We were also inspired by Atlantic Magazine's COVID racial data tracker, which was one of the first to try to address the paucity of data related to how the pandemic was disproportionately affecting people of color. As migrationists, we turned to the Center for Migration Studies COVID-19 Migration-Related Developments Initiative. As you know, there were several travel bans that were put in place globally and also in the United States. And so many of the questions that those of us who study migration wanted to ask was, what were the justifications of these policies? How do they relate to historic trends? What will it take to open up migration and travel in the future? And then one last resource that is worth calling attention to was Harvard University's guide, a library guide, Black America and COVID-19. And so beginning in the summer, we started doing a lot of research to create a curated digital collection of news reports, of data, perspectives, and other resources to document the health, the economic, the social impact of COVID-19 on immigrants and refugees in the United States. And we focused, along with our team of graduate students, we identified 4 issues that we thought were particularly salient to immigrants, refugees, and asylees during the pandemic. The first one is immigration policy. The second is health. The third, labor and the economy, and then xenophobia. We thought it was extremely important, with all of the misinformation that was circulating, to highlight fact-based research and reporting from reputable national media sources and think tanks, as well as immigrant, ethnic, and local media. And one of the other things that we wanted to do was, here's some of the resources that that inspired the project: the COVID-19 racial data tracker, the Harvard's library guide, Black American Experiences During the Pandemic, and then the Yellow Peril resources to address coronavirus racism. The other thing that we did as part of our project was to establish a partnership with the Theahan Journal, which is a nonprofit digital newsroom. If you don't know already about the Theahan Journal, go to their website. It's one of the most just wonderful community-based news media organizations that is focusing primarily on immigrants and refugees here in Minnesota, and really doing path-breaking work. The Immigration History Research Center, which I direct at the University of Minnesota, partnered with the Theahan Journal to create digital stories documenting the experiences of immigrants and refugees during the pandemic, and posting them both here on our site, but also on the Theahan Journal. To date, there are 5 stories that range from the one that you see here is a profile of Obala Abala, who is an Ethiopian refugee who ran for city council in Austin, Minnesota, and won. So what was it like to campaign during a pandemic? There's a profile of a path-breaking Somali journalist who passed away from the pandemic. There's a profile of a Somali American teacher and children's book author who discusses teaching and learning during the pandemic. So we wanted to balance this sort of news reporting with personal stories and experiences related to the pandemic. So I thought I'd give just a brief update on 2 of the issues that that the research focuses on, and then pass the baton to Madalena in the second half. And the first one that I thought I would start with is the topic of xenophobia. This is an area of research that I feel deeply connected to as an Asian American and as an Asian American historian, and also I had just finished writing a history of xenophobia in the United States. So I was deeply aware of the reports that were coming in of anti-Asian hate, but also of the sensationalist and racist narratives that were circulating throughout the media, beginning really with January 2020. So even before the pandemic spread throughout the United States, we saw that COVID-19 was falsely linked to uncivilized Chinese eating habits. We saw that Chinese people and those assumed to be Chinese or Asian were being blamed for bringing the so-called Chinese virus to the United States, most notably by former President Trump. We saw that thousands of Asian Americans were reporting that they were experiencing increased racism and hate. They were being yelled at, they were being spit upon, they were being harassed and physically attacked. We noted that this then led to the idea that all immigration was a public health threat, and that the United States started closing its borders and drastically restricting immigration. So as a historian, I knew that we have a long history of tying immigrants to disease. But what is different about the pandemic is that the anti-China and the anti-Chinese messages were brutally and also strategically promoted by many. The WHO, back during SARS, during Ebola, had put out directives that recommended lawmakers and health advocates to refrain from attaching locations or ethnicity to disease. They say that this is because doing so often leads to stigmatization and discrimination. But here in the United States and in many other places around the world, the rhetoric, especially by some of our politicians, did not follow those recommendations. They started regularly referring to the virus as the Chinese virus, the Wuhan virus, and even Kung flu. The labels became popular. Their use by President Trump and other lawmakers caused many Americans to view the virus through the lens of anti-Asian xenophobia and racism and anti-China foreign policy. Some of the research that we document as part of the COVID-19 project has showed that this rhetoric directly translated into incidents of racism and violence against Asian Americans. A recent Pew Center research report and survey found that 60% of Asian Americans have reported an increase in discrimination. So what you see here is the beginning of reporting on what the LA Times called the epidemic of hate, but also a very swift response by community organizations serving Asian American Pacific Islanders. A coalition of policy groups and organizations launched the Stop AAPI Hate project to track anti-Asian bullying, harassment, and hate incidents, and also to advocate for policy responses. By December of 2020, they had published over a dozen reports that analyzed the impact of anti-Asian rhetoric, but also documenting hate crimes targeting Asian Americans. Its most recent national report recorded over 2,800 anti-Asian hate incidents in the United States since March. This represents an 1,800% increase from previous years. So just as a point of comparison, FBI statistics note that anti-Muslim hate incidents increased by 1,600% after September 11th. We also know that as part of this, this increase of xenophobia in the United States, that this wasn't just impacting Asian Americans, it also directly translated into policy. It prompted and justified the Trump administration's enactment of new and unprecedented immigration policies. So some of the first travel bans that were put in place in January and February related to China and the UK, and its border closures mirrored those of many other countries that were implemented in the early months of the pandemic, weeks and months. But what set the United States apart was the administration's use of the pandemic as a pretext to enact new restrictions on almost every type and category of immigration in the months that followed. Policies that went far beyond the limited travel restrictions that other countries put in place. So for example, in February and March of 2020, the president justified his plan for the wall along the US-Mexico border to quote unquote, keep the infection and those carrying the infection from entering our country. This was a continuation of his anti-Mexican immigration rhetoric. When you pair that rhetoric to the facts at the time, the disparity between the number of COVID cases in Mexico and the number of COVID cases in the United States was drastic. We had much more infection in the United States than in Mexico. The administration also cited the threat of infected immigrants from Central America and Mexico when it announced the unprecedented order that empowered Border Patrol agents to immediately return all individuals trying to enter the United States across the US-Mexico border. And this included turning away asylum seekers. The US was also the first and only country to use nativism, meaning the protection of Americans and American jobs to justify immigration restrictions during the pandemic. We include a report on the site from the Migration Policy Institute that shows that the Trump administration put into effect 63 immigration-related actions during the first 6 months of the pandemic alone. Together, these policies halted the entry of almost every type of immigrant seeking to settle in the United States and represent the most sweeping immigration restrictions implemented ever in American history. These include those that were put in place during the 1918 flu pandemic, and also during previous health, economic, and international crises like the Great Depression, like World War I and World War II. We saw that the restrictions had an immediate impact other reports on our site show that during the second half of 2020, 92% fewer immigrants entered the country than during the first half of the year. And this represented the largest decline in immigration in the history of the United States. So that is where we are now in terms of xenophobia and immigration policy. There have been some changes that the Biden administration has put into place. It did issue a memorandum that that condemned and sought to combat xenophobia in the United States. He signed that, I think, the first week of his administration, but there have also been a rash of horrific and very public attacks on Asian Americans just this past week, and it's unclear what that proclamation, if anything, will do to prevent that. In addition, just yesterday, President Biden unveiled, and congressional Democrats unveiled, a new immigration bill. But so far, many of the pandemic-related policies are still in place or under review. So now I'm going to turn it over to my colleague, Professor Maddalena Marinari, who can help us understand the health and economic impact of COVID.
Thank you, Erika. Hello, everyone. Thank you for the invitation, and thank you for being here on a Friday. As Erika mentioned, I will cover some of the other elements that we've been focusing on in our research. And just very briefly, we also, in addition to looking at the changes in immigration policy and the skyrocketing number of episodes of xenophobia, which eventually also targeted people within the Latinx community, we also focused on the impact of the pandemic on immigrant workers, on their health. And then very recently, we also decided to add an additional category of analysis and research, which is COVID-19, vaccine distribution, and equity. So the last point is perhaps the least developed, but although it was not as covered throughout 2020, towards the end of the fall and now the beginning of 2021, there's more and more research about that. So you probably, there was a bit of an irony between the fact that over and over, many of these workers were welcomed as heroes and declared essential, and as such, the implication was that they should be prioritized. But sorry, yes. And so what our research revealed is that immigrants played outsized roles, that they're really in prominent numbers present on the front lines of the war against the virus. So oftentimes they are in really high numbers in the healthcare profession, food production, and transportation. And so on one end, they're clearly essential to the functioning of the country, but that also means they're some of the most vulnerable population to essentially getting the virus. And we saw that when it came to food production, even a plant here in Minnesota had to shut down because of a COVID outbreak. What our research has revealed essentially is that many of these workers face an impossible decision, whether to keep their job, go to work, and get paid, or risk an infection, right? And so sometimes, in part because not all of these frontline workers are documented, there is also an added risk where some of them don't really feel like they have a choice, essentially. And I wanted to mention two examples that kind of illustrate both of these tensions, right? So the narrative that they are essential to the literally the survival Americans and the continuation of American economy, and the risks that they face whenever they do that. So oftentimes a lot of immigrants are concentrated in specific jobs, not necessarily by choice, but it just so happens that a lot of Filipino immigrants, for example, are nurses. Well, some research in California has demonstrated that not only in the state, for example, they are the highest number of nurses, but they also have the highest mortality rate. And the research also shows the sense of a lack of choice for these individuals, because as nurses, they feel like they have to contribute and participate and do their part in fighting against the coronavirus. But on the other hand, because they're so highly concentrated in this health profession, they've suffered a really high mortality rate, which has affected in turn their families and their communities. Even perhaps more complicated are the many frontline workers who are undocumented. And this is also an issue when it comes to seeking healthcare or vaccinations, because some of these individuals essentially worry about revealing their identity, their status. And so they tend not to seek help when they're sick, or are more reluctant to get a vaccine. But at the same time, the downside of that is being frontline workers, this delays our ability to reach herd immunity and allow everyone to live and work safely. There's also building on, so in terms of immigrant health during the pandemic, there's plenty of research that has shown that just like for Black and Indigenous communities, the rates of infection, illness, and mortality are actually much higher among immigrant and refugee communities as well. In part because they're underserved, but also because there is hesitation in seeking help. And I think one of the other elements that we need to keep in mind is also what Erika just discussed, right? The fast pace of changes in immigration policy and the rhetoric attached to the pandemic hasn't built a environment of trust where these people feel comfortable either revealing that they're sick or not going to work or seeking help, essentially. There's also another problem, which is, again, not exclusively related to immigrants and refugees, but it's also clear that detainees who are immigrants who are in jails and immigration detention centers are particularly vulnerable to catching COVID-19, in part because it's a lot harder to social distance, or physically distance, and there's also less protective equipment in these facilities. But this is something that has been underreported when it comes to these particular communities. But you can definitely see the number rising. So just in the first 2 weeks of January, 2 immigrants died while they were in ICE detention. Even more complicated is what is happening to asylum seekers. So the Trump administration decided that asylees could not be allowed into the United States. This predates COVID, but it had a long-term effect. And so essentially it asked the Mexican government to house these asylum seekers while they work through their claims. And so as you can see the photo of one of the encampments here in Matamoros, Mexico. So they look like refugee camps. And unfortunately, I was not able to find a photo of the camp affected by the recent wave of ice, snow, and cold. But this is essentially the conditions that these people are living in while they wait for their case to be processed. And so the time, it's not just the precarious conditions that essentially leads to much higher rates of infections, illness, and mortality. This is also a very stressful environment because oftentimes these refugees, these camps are in areas that have crime. A lot of these people who are escaping already dangerous conditions have been mugged, attacked, robbed, some even raped. And because of COVID restrictions, their cases are taking a lot longer, oftentimes because the offices are closed. And so they can't move their case along, or they have significant delays. For some of them now, the waiting period is about 2 years. But when it comes to their health, they're living in very close proximity. They often don't have good protective equipment. There are several organizations that are trying to help them, but the need and the help, there's a gap between the amount of need that this community have and the help that is being provided. And so not surprisingly, the number of cases of COVID-19 in these populations has been particularly high as well. So the last, the new development of our research was to understand how vaccines were being distributed among these populations, and the kind of access, but also the narrative around. So perhaps you know that there's been quite a bit. On one hand, we have some good news. There was a lot of coverage in the press that emphasized the immigrant origins of a lot of the developers of the vaccines, particularly Pfizer, where there's a Turkish immigrant and a German immigrant involved. And that seemed to present some of a somewhat positive development in otherwise very depressing research that we've been doing. But when it comes to the actual distribution, things get very complicated very quickly. So on one hand, a lot of these communities have essentially learned from the disparities of a year-long pandemic. And so they've begun to push to include undocumented immigrants, BIPOC, and lower income communities. And because they're generally the most affected, but also the most underserved. And here, for the first time, perhaps, you have some legislators pushing for that as well. So in recognition of some of the inequities that the pandemic had created among this community, not just in terms of infection and mortality rates, but also the ability to provide care. So there is at least a recognition that somehow these communities should be prioritized. But again, one thing is the recognition, and the other thing is what is actually happening. And so one of the two other findings that we identified in this research is that there is actually quite a bit of misinformation about the vaccine among immigrant refugees communities. And this is a bit trickier to track because oftentimes this misinformation is in these immigrant refugee languages. There's been quite a bit of coverage about the really extensive web of misinformation among the Latinx community. So most of this information is essentially distributed in Spanish. And so now a lot of Spanish speaking leaders are trying to come up with a way to persuade these communities to take the vaccine, again, in part because they're also oftentimes frontline workers, but they're also oftentimes the most affected communities. But in general, from our research, it's very clear that there are quite a few barriers, right? So perhaps even institutions that are trying to be aware and intentional about how to do outreach in this community, there is a lack of trust. a lack of trust that essentially has been growing within the last 4 years, for mostly because of the changes to immigration policies and the messages that they're sent. There's the Migration Policy Institute has essentially tracked over 440 changes to US immigration policies. But also it's not just how these policies have changed, but also the rhetoric that has been attached. And so that has created a huge lack of trust from among this community towards the government. And there are also more practical obstacles our research reveals, which is language and digital divides. And here it's very like not everyone, for example, has access to a phone or an internet connection. And so reaching this community might require some different, more creative strategies, which I think would also allow us to reach other communities that are underserved, like lower income communities and BIPOC communities. But the other piece that seems to be important in these conversations is that who you work with in these communities seems to be important. In other words, finding partners that can lend legitimacy to these efforts to immunize immigrants, asylees, and refugees might be key. And also finding ways around linguistic barriers. And I know that MDH has actually done a great job because they intentionally translated a lot of information in a lot of different languages from the very beginning, which is not something that happens across consistently in the United States. But also kind of thinking more closely about the digital divide. I will stop there because I know that people probably might have questions, but I hope that was a helpful overview. Thank you.
Thank you so much. To our attendees, if you are interested in submitting questions, you can find the Q&A button, or you can do that through the chat too. I'm monitoring both of those places. And I don't see any yet, but to get us started, I'm wondering if there's any historical evidence for, and maybe there isn't a totally congruent example, but a big historical event, a worldwide event, or what is the historical evidence of evolution in maybe both policy and or public sentiment over time after those events kind of fade out? So can you tell us maybe what to look for in the next couple of months or years in those areas as a response to what we're still currently experiencing, if that makes sense?
Is that a way of asking when are we going to get back to normal in terms of immigration? Or
maybe not back to normal, but is there historical evidence for like continued change in certain directions, positive or negative? And those are my own biases maybe coming up about that. But like what are the longer term effects of an event like this on policy or public sentiment toward immigration?
Madalena, do you mind if I start and then?
No, please go ahead. And then I'll think about it.
Yeah. So one of the things that I have found astounding is, as someone who thought they were keeping track of the policy changes over the past 4 years, it seems that we collectively as citizens are just beginning to understand the magnitude of what has changed. So we all have read the headlines of the Muslim ban and child separation, et cetera. But I recently was reviewing the Immigration Policy Tracker Project, which is a project that comes out of Yale University with an army of students, 70 students, who have been tracking every single policy change under the Trump administration, and they're at over 1,040. And the changes are big, the ones that we all have heard about, and tiny, slight changes on a obscure bureaucratic form. But altogether, the analysts have said they represent, a move and an attempt at strategic immigration restriction across the board. And so as we are taking note of this flurry of executive orders, the bill that was just introduced yesterday, and President Biden's, commitment to, return the United States to honor our commitment to immigrants, the policy analysts are saying this untangling of this enormous web of policies may never really happen, frankly. Like they are it's going to be so difficult to do. And of course, immigration is not the only thing that is on the president's agenda. Of course, the pandemic, climate change, et cetera, racial equity are all high priority items. So it's not clear that we will ever, reset if there was a norm that we had begun with in the first place.
Yeah, I was going to say something similar. I think a lot of analysts have come out and said that it's actually easier to break than to fix immigration policy, in part because it's so vast, but also because of what Erika just said. Some of the changes are so small that it's easy to lose track of them. But I think historically we can also say that unless there is a concerted effort to rethink immigration and the way we talk about immigrants, refugees, and asylees, we're going to find ourselves again in this situation. It might be another crisis. And that leads me to another point that I want to make briefly. I think we have enough big challenges ahead of us, like global health, climate change, and those are all tied to migration. And so these should be a wake-up call. In other words, it's not just about surviving this crisis, but we should do kind of a lessons learned, right? Because it's not possible that it shouldn't be possible that refugee asylees are left in those conditions waiting. I mean, those are people fleeing persecution, right? And they don't know what their future holds, right? And I think we're gonna only have more crises, not fewer. Thank you.
Great, thanks. And someone shared a comment, I think about my question, that it's a hard question to answer because it also depends on the people in power and their stance and view on immigration. And so that interacts so much with public sentiment and how policy is made. Another comment for Dr. Marinari on vaccine challenges impacting immigrants and people of color. In Minnesota, currently, it seems we don't have very good or much data on vaccinations by race. So it's hard for those who work at the county in public health to understand how well or poorly they're doing in vaccinating those groups. And that's something that's being discussed at the state, but isn't yet resolved, which I'm sure you've seen in your research. Another question, someone said that they volunteer with immigrants and refugees. What resources might they be able to provide for Spanish-speaking students who may be undocumented to help them understand how or where they could be vaccinated without revealing immigration status, if you know?
Yeah, I would like to point people to, I'm going to call up the website. My colleagues in the med school and in public health have established a national resource center that focuses on mitigation, vaccination, pandemic-related education devoted to immigrants and refugees. And it is called National Resource Center for Refugees, Immigrants, and Migrants, or NRCRIM. And I'm going to put the URL into the chat box right here. They're just getting started, but they have a growing number of resources, health education, toolkits, training, resources that are available, including, it looks like, a new dashboard, Vaccine Central, resources to support vaccine efforts among refugee, immigrant, and migrant communities. So this is, it's a great resource for us here in our region, because it is, to my knowledge, the only national center that's devoted to addressing these issues directly related to refugees, immigrants, and migrants. And I'd recommend them as another event or speakers, you know, for HUP, to be sure, because they're really doing. Madeleine and I are kind of studying this on, you know, from a perspective that's up here, and my colleagues are, and their community organizers are actually doing this work to assist and to create resources as well.
Great, thank you for sharing that. I'll include the link in the follow-up email as well. And I think that is a great idea for HUP to look into as one of our next events. And to our county attendees, if you're interested in connections there, always email HUP and we can do our best to help you make those connections. Another question, in your research, how or have you seen interaction between this recent, in quotes, pandemic bearer narrative about Asian Americans and the older model minority narrative about Asian Americans in mainstream American discourse, even though both of these are really maybe fallacious stereotypes?
Yeah, that's a great question. Both are still very active, and both sort of interact with each other. So the model minority, you know, we may understand it as the minority that is supposed to be the model for others. So Asian Americans, the stereotype goes, are hardworking, pull themselves up by their bootstraps. They do it on their own. It's a work ethic and family values and a respect for authority that is cultural, the sort of built into the Asian American experience. And the roots of the stereotype were created in direct opposition to the Black liberation movement. African Americans calling on a systemic an end to systemic discrimination. And so it was really used as and is continued to be used as a wedge issue to place Asian Americans in opposition to African Americans. But the other part of the model minority that we don't recognize as much is that they are still a minority, meaning that they are not just a minority numerically in the United States, but part of the model minority emphasizes their foreignness, right? Because part of what makes them model is their Asian heritage and culture and their adherence to Asian values. And so as a continually foreign and forever foreign kind of peoples, it's not so hard to then bridge over to the Asian American as model minority, to Asian American, inherently connected back to Asia, to virus coming from China, something that is part of Chinese culture because they eat weird things. And then, Asians in America, because they're, inherently directly linked to Asia still, being the pandemic bearer. So they really work in tandem with each other. And it's also important to know that the model minority is a very unstable racial category. Anything can change at the moment, especially when there are antagonistic US foreign policy relations that are being promoted by our leaders.
Thank you. One person said they'd love to hear more on the ground examples about the pandemic's impact on immigrants and refugees from other attendees. And I think that that's probably also something that there are for the Theahan Journal that you mentioned and at the Immigrants and COVID America project, lots of information and stories to look to there. So we'll share both of those.
That was actually me who said that to all of the attendees.
Oh, sorry.
Yeah, no, I said just, drawing on the previous commentators' note about what we're seeing in Minnesota. I wanted to say, hey, share more, tell us more. You can do that through the chat, but also on our website, there's a link that asks for feedback or source suggestions and other things. And also you can feel free to email either one of us. So yeah, that was me saying, I'm sure people who are participants have much to share with us as well.
Great. Well, and so that brings me to the next. Oh, please, yes.
I was going to encourage everyone to do the same. We would really like to flesh out our section and the amount of information that we have about Minnesota in particular, because it's clear that Minnesota is doing some things really, really well when it comes to these populations. I think one thing that is hopeful is that you're seeing more inter-ethnic collaboration because the need is so strong. But if anyone has stories that they'd like to share or resources, please send them our ways. Thank you.
Another comment came through about concerns on documentation status and getting vaccinated. The county and state-run clinics will not ask for this information and data are kept private. So in the chat, I'll share a link that one of our attendees shared for Hennepin County. There's a online FAQ on this on the page, and then that's available in multiple languages. So Hennepin County is doing good work.
I was about to mention that. I think what's discouraging is that a lot of this is local, right? So there are some communities that are more proactive and mindful of these issues. So I think this is one case where having some federal guidelines on not collecting this kind of information would be helpful. For example, I filled out the connector yesterday, and you don't get asked about your status, right? It's really about what are your needs? What is your life? Where do you stand in this list of priorities, right? And I think that also sends the message that your health is what comes first. It doesn't matter what you look like, what your status is. And I think more of that would also go towards building that trust that has been shattered in the last year and 4 years. And so it would help us make progress again and bridge some of those gaps.
Another question that I'm really interested in, because it's a conversation we've been having in a class that I'm taking right now at the U about migration. Attendee asks, will the status of refugees be expanded to include climate and economic refugees? What do you think from your perspective, or do you know?
I don't think we know. I think this is one of the most pressing questions. This would be a great time to share the work, another collaborative project that Madalena and I are involved in, which is the Migration Scholars Collaborative. This is sort of an outgrowth of some of the work that we did back in 2016, which is to try to provide historical and other scholarly perspectives, kind of translate some of the breaking news and policy directives to students, to the general public, to journalists, to policymakers. And you can find us on Twitter at, what is it, Madalena? If you just do a search for Migration Collaborative, right? I'll find it. But also on the IHRC, the Immigration History Research Center website, we have started to collect some of the work that, thank you, that we are doing, which is to annotate some of the Biden immigration policies. So taking the full text of executive orders and proclamations, there's a team that's doing this with the new immigration bill as we speak. And putting our perspective in terms of where's this coming from, what's new, what's not, what's at stake. And I believe that we will have soon some comments on the executive order that related to climate migration. But this really is, I mean, we're just at the tipping point of a tremendous amount of potential for change, but it's going to be in the details. It's going to be in terms of what gets negotiated and pared down and compromised, et cetera, through the legislative process. So the answer is, I don't think we know yet, but there's a number of people who are thinking about this a lot, and sort of stay tuned is what I would say. I don't know, Madalena, if you have more.
Just very, very briefly, I think if nothing else, talking about these terms that we use that in our mind are very rigid. So someone whose livelihood is being destroyed by a flood, right? That person probably leaves for both work reasons, he no longer has a way of supporting themselves, right? But also for environmental reasons. And so I think more and more we'll see that immigrants, refugees, and asylees might be too rigid categories, because sometimes you could be a climate refugees, but you're also looking for work because you no longer have a source of livelihood. One thing that I would say that I see as a positive development in terms of how we talk about immigrants is the executive order saying that we should no longer refer to them as aliens, but rather non-citizens, because I think that goes a long way. It's just a linguistic change, right? But I think that's helpful to help change the rhetoric around immigration.
Certainly. Well, we are getting very close to the end. There's two more brief comments. One maybe is more for us at the HUP. Will we have another webinar regarding migration, climate, and effects of Biden policies? And maybe if our presenters would be willing to come back sometime in the next year or so, or would have suggestions for other researchers and faculty who we could schedule something with, I'll add that to our list of areas of interest for topic. And then one more very brief question before we wrap up. Is foreign born an accepted term? What do you think of that? Going back to the language question.
I think so. I mean, we're starting from just off of the Trump administration. We're starting from a pretty low bar, I would say. So foreign born is a neutral term. I think as Americans, one of the greater transitions we will be looking at is immigrant to migrant, just recognizing that not everyone has before or now intends to settle permanently, which is the more traditional term for immigrant, but that certainly in today's globalized world, migration and migrant is much more flexible and perhaps a better realistic term to apply to a great majority of people who move across international borders.
Well, it is 12 o'clock. I want to say thank you so much to both of our presenters for joining us and to all of our attendees. We hope you've enjoyed the presentation and look for the email from us with links to all of those different resources and sites that our presenters have mentioned today. Thanks so much and have a wonderful weekend, everybody. Bye-bye.
Thank you.
Thank you. Bye.